Okay, my name is Malcolm Alexander. I'm the chair of Health Watch Hackney, and want to welcome everybody here today. We got two main speakers. There's Raya Feldman, who is the ex-chair of the Migrant Centre, and a leader of the centre. She's a role that she's had for many years, and she operates with them as a volunteer. And we have Thomas Clark, who is the primary care program officer for the CCG, based at St Leonard's. So the reason for the meeting is that we produced, I'm sure you've seen the report that we produced on registration, and we were getting a number of people coming to us concerned about the difficult registration. So what we decided to do was to actually raise the issue with the Health and Wellbeing Board, and then we decided to contact all of the practices in Hackney to find out what the situation was. We just phoned each practice and we asked them about registration. And we got a very, very wide range of responses. So the basic response should be that anybody's entitled to register. But actually what came back was rather different from that. So we decided to proceed with this. We actually been working with the CCG, who have responded very well, and in fact Richard Bull produced a very positive letter following our report, and we will be doing a repeat phoning through to practice in a few months' time to see what the situation has improved. There's also, you may have seen, a very good article in the local Hackney newspaper, probably could see, which actually goes into just the right level of detail about people's right to register. So that was a very good outcome, I think, to the original piece of work. So now I'm going to hand over to Thomas, who's going to present to us initially, and then when he's finished, then Raya will present to us. So thank you very much, everybody.
Okay, so I'm a program manager, a primary care program manager at the CCG. As Malcolm said, Health Watch did a recent report and they called round practices, and there was quite a mixed bag of responses. But the purpose of me being here today is just to go over, I'll go through these slides very quickly actually, and it's just to go over a few questions that were raised in advance of the meeting. But then I'll try and kind of open it out to for as long as possible, just the general questions from the group. So these are some of the questions that Richard received in relation to GP registration that we're under the impression that you would like to get answers to today. So I'll just move on fairly quickly. So how to register with a GP? Basically, you find a GP that suits you, that suits your need. You can do this through a number of different sources. So you can use this link here, which is basically will find you any GPs within a certain sort of number of miles from your address. And then once you've sort of identified a GP that you think might suit your needs, then you can either go to their website, see if they've got online registration, or you can call them and just ask. Although I suppose calling is sometimes a bit more difficult these days because they're very busy. In some cases, you can sort of download a registration form, this GMS1 registration form, which is the standard registration form for GPs in this country. But you'd have to print that off and complete it. So as an alternative, if you live in Northeast London, there is this link here, this website here, and currently sort of about 75 to 80% of practices in City and Hackney are signed up to this. And basically you go and you enter your postcode, and then it will search and it'll present you with a list of GP practices for whom you fall in their catchment area, and then you can complete an online registration form and submit it. And then that will automatically go through to them, and they'll register you, and then maybe contact you for a health check or any further check subsequent to registration. So this is a big thing, and I think this is the main point of contention in the Health Watch report, is that some practices were still asking for proof of address or ID to register when that is not required. They will ask you for your address. They might want to check if you're in the catchment area, but you don't need to provide a document to prove that's where you live. Equally, ID is not required for registration, although we will later on, we'll get to a point where, because ID is required if you want to have access to your medical record online, because obviously they can't give you access to all of that very sensitive information without sort of verifying your ID. There's various ways of doing this though, which I can sort of answer questions on later. This is text that you'll find on the NHS website around GP registration. It just says that it might be helpful to have one of those documents if you have it, but not having it should not prohibit your registration. So here's some things about what to do if you're refused registration. So, I mean, there are some circumstances where a GP can. So if a patient, for example, lives outside their catchment area to varying degrees, that can potentially compromise the care that they're offered by the GP. There's a few reasons for this. If you're, for any reason, in need of a home visit, for example, and you're too far away from the practice, that can be a problem. But also to do with place-based commissioning and having sort of local like referral pathways that we've commissioned for the needs of our population. If you live, for example, in a neighbouring borough, some of these things can get quite difficult and it may have an adverse effect on your care. So being outside, they can, if you're outside the catchment area, they can say no. But there are other things as well. There's like if you've previously been removed, although you would have had to have done something pretty extreme for that. And also sometimes they can be given temporary permission to close their list. So they have to apply to us as the CCG, the commissioner, for that purpose, to do that basically. But it's normally due to some sort of extraordinary circumstances. They just don't have capacity, a shortage of staff, for example. So it's always worth, so if you do have problems registering, there's some places you can call or contact Health Watch, of course. But it's always, I suppose the point here is it's worth asking if you shouldn't ever really be refused. But if the GP is saying they're going to refuse your registration, then they really need to give you a reason at any point, regardless, so you can sort of check that against your knowledge now of what is permissible and what isn't, and so you can sort of follow it up. So changing GP practice is much the same as registering for if you've never registered before. Basically, you just find a GP that you want to change to. It might be because you've moved house or any number of reasons, and then you just will submit a registration form according to their process, and basically all of your records and your medical information will automatically transfer between your old GP and the new one. And then I suppose this here has been a question that's come up regularly, is whether you need to be registered with a GP to get a COVID-19 vaccination. I mean, broadly, the answer is no. On days, for example, where local vaccination centres are doing walk-ins, and if you haven't ever been registered and you don't have an NHS number, you can potentially walk in and they'll issue you with a temporary one. But more or less, like it's sometimes helpful even if you're not registered locally, whether if you have ever been registered, to kind of look up your NHS number, because it's quite useful to have. And the other thing I suppose to mention here is that if you're not registered with a local GP, you won't be on the list of patients that they call and recall. So you won't be proactively contacted about the vaccination, which may prove problematic. So I suppose that's the end of the slides. I'm quite happy to, I'm not sure how I cancel this share on Zoom. I'm not a regular user of Zoom. But yeah, I'm quite happy to take questions from people that are here.
Right. Any questions first? Any questions? Hello? Yeah. Carry on. What is your question?
I see. So right, because the GPs for I know, like, undocumented, because our community members are mostly consist of undocumented ones, and yes, of course, they have right to register on GP without ID or a proof of address, right? But I would want to ask, would they be able to use the GP for other treatments aside from COVID vaccine? Like, what is the scope of their rights as undocumented registering on the GP? Like, are there treatments that they will be reported to the immigration, or like, what's the scope of this?
So there's no. in a word, there isn't data sharing between immigration in the Home Office and NHS organisations. There's that was briefly in place a few years ago, but it's since been removed because it wasn't seen as a particularly good thing to be doing. Undocumented migrants have also, like other people, have a right to primary care, and they can access primary care services free. So any treatment that is undertaken by their GP practice once they're registered will not be charged. So they can access all of those treatments. I suppose the difficulty comes if they have an acute problem or a problem that requires a referral to a secondary care or hospital provider. Then that becomes a bit more of an issue, because once you do there are reasons, or there are mechanisms by which a charge might be coming to that person, because it's much more expensive care. I mean, the moment you walk through a hospital, at the door of a hospital, it costs some other public purse to hundreds of pounds. So I think that's anything that is directly provided or offered by the GP practice that they're registered to, it will be free and they won't have a problem accessing that. But if they do need referral onwards, then that becomes something that might be chargeable depending on their status. And it's quite complicated. I wouldn't want to elaborate on that, but I can circulate some links that might sort of explain the circumstances a bit better.
Thank you so much.
Thank
you.
you.
That makes sense. So all the primary care is free, but the acute ones would be charged.
Potentially chargeable, but again, this very much depends on the case.
Except, of course, accident and emergency, which is also free.
Yes, accident and emergency, that's it. But I mean by I should have said sort of elective referral based secondary care.
Yeah. Okay. Thank you. Thank you very much.
I do have another one.
Oh yes.
Yes, it says we have this one query from our project. Because if a person has a legal status before, and now is a undocumented migrant in the UK, and they are trying to move to GP, would it be the same scheme, or would it be the same scheme, like they won't need to provide passport or proof of address?
Yeah. So basically, but you do not need to require any documentation at the point of registration with a GP.
I see. Thank you so much.
Thank you very much. Any other questions, please? No? Okay. I suggest we go over to Rhea now, and then we take. We do have other questions, but we can take those other questions when Rhea has finished her presentation. Thank you so much, Rhea.
So, just to check, Malcolm, you'd like me to stay on for the questions at the end?
Yes. Is that okay? Because we do have other questions that would interest you. Okay, thank you very much.
That's fine. Thanks.
Rhea,
you are on mute, Rhea. Okay.
Right.
You are still on mute. I'll ask you to unmute now. A message from on your screen. Perfect.
I've unmuted, and I'm trying to share my screen, so I need to find the right thing.
You did.
Yeah, I found it. Okay. And I'm there, am I? It's a bit confusing.
Yes, we can see the first page.
Okay, that's great. All right, so I'm going to talk about, I mean, it's really interesting, and I do hope Thomas will stay, because actually there's a lot of issues that arise in relation to the apparent ease of registration. So I'm actually going to talk about barriers to access. And just to correct Malcolm, I've never worked for Hackney Migrant Centre as a paid worker. I'm a founder, and I was the former chair, and I've always volunteered with Hackney Migrant Centre. Okay, so I'll go straight into what I'm going to say. I want to start by saying something about migrants, because not all migrants are the same, but the ones that we're talking about who have difficulties registering sometimes have very distinctive needs, and I've just listed some of them here. I mean, people may have recently arrived, have no idea how the NHS works, don't know what an NHS is, don't speak English. Some may not have papers, some will have papers. Given the complexity of the immigration system, some have funny papers like limited leave with no recourse to public funds, which means that they can't get benefits, but the NHS, sorry.
Aya, just to let you know that this is not your presentation that you're sharing.
Oh.
Yeah, you share the Safe Surgeries toolkit.
What am I sharing?
The Safe Surgeries initiative.
Oh, sorry.
Would you like me to share the presentation?
No, I don't want to share that. Let me stop sharing.
Would you like me to put it up?
You are stop. Well, let me try and put it up,
okay.
Because, okay, sorry.
That's okay.
Oh, right, I see. That was something else. I got it all ready. Microsoft PowerPoint, that's it. I apologize. Okay.
Right.
All right. So are you in the window that says barriers to GP registration? Oh, no,
yeah.
I want the one before.
Yeah.
I'm talking, migrants have distinctive needs. Yeah.
Yes.
Yep.
So as I say, if you have no recourse to public funds, it's got nothing to do with the NHS, but people don't always realize that. As I say, some people can't speak English. Some people have long-term conditions where they need care urgently. And there's a difference between people with families and children who need immunizing. There are lots of people who are homeless or have very precarious accommodation. And that, of course, so those two things, the kind of documentation you've got and the kind of accommodation you've got, actually feeds into the whole question of your need for proof of address and your need for ID, or if you're asked for those things, even though you don't really need them. And obviously, if you're a person with a history of trauma and abuse, which many people are who try and register with GPs, then all these things become very, very problematic. And I'm going to come back to that. And so the point is that all of these distinctive needs need to be understood and sensitively addressed. So just because it's possible for migrants to register in theory as easily as the resident population or citizens, actually it isn't so easy, because they've got all kinds of issues that probably people who've lived here for a long time, or like me have grown up with the NHS, actually don't have. And they really often don't know their way around. And I want to talk about specific barriers to registration. Well, first of all, we have talked about the registration requirements, the proof of address and proof of ID. And I really welcome the report from Hackney Health Watch. I think it's great, but it's also quite shocking that nearly 2/3 of practices that they surveyed in Hackney wanted proof of address. And it's really difficult. I talked to somebody just the other day, because I see migrants who come to Hackney Migrant Centre for advice. And this was a man who's actually lived here for 11 years. He's a refused asylum seeker. So technically he's undocumented. I don't know whether he ever came with a passport, because he came in a lorry, and he's been refused asylum because he didn't present enough evidence. He's hugely traumatized. Because he's been refused asylum, he doesn't have access to benefits or work. And he moves from friend to friend, and he's staying with a friend, and it's hard for him to prove both his identity and his address. And there's many people like that. And the problem for him is not registering online, it's having these proofs. And I rang up a potential GP for him who said, we definitely need proof of address. And so I conceded and said, okay, his friend will send him a letter, but he, you know, and then they wanted the friend's utility bill. Well, I'm not sure that he could have the friend's utility bill. And I'm just saying that because I know that it's possible, you should be able to register without these things, but actually practices are asking for them and they are deterring people. Secondly, I think it's really important to know that we really do live within a hostile environment for migrants, and that affects all sorts of things. We can't guarantee that there's no data sharing between primary care. There isn't a memorandum of understanding, which there used to be, and that was actually stopped in 2018. But nobody really knows. And the fact is that there's a huge amount of data sharing between the Home Office and hospitals. And again, it's very difficult for people to be able to distinguish which bit of the NHS doesn't share data, which bit does share data. What happens if you're referred to the hospital for a blood test? Will the hospital ask the practice to confirm the person's immigration status and their eligibility? And I have to, I'm afraid, take issue, because I think it's part of the hostile environment. I have to take issue with Thomas. The cost of hospital care is not what is behind the charging of migrants. The charging of migrants is a deterrent policy, which is to use the NHS as part of the hostile environment. And people feel that. And it's been said in relation to vaccine hesitancy about COVID as well. So I think we must remember that all this is happening in the context of a hostile environment. And people are afraid of sharing, of data being shared with the Home Office. Other things we've mentioned, obviously there's language barriers. I mean, if people want to register, then they may actually, if they haven't got a friend who knows English, they may need to have help with registration. A frequently cited issue is hostile and unsympathetic attitudes of reception staff. And I have got one recent case from Hackney Migrant Centre that one of the advice workers told me. She said, a few weeks ago, one of our visitors, aged nearly 70, tried to get antibiotics from his GP as he had cellulitis in his foot. They asked him if he smoked, and he said he sometimes smokes weed. He's a Rasta. It seems the GP receptionist refused to give him an HC1 form, which is the form you need to claim exemption from prescription charges. And she said, if he can afford weed, he can afford to pay for his prescriptions. And he didn't get a prescription. And it resulted in him being hospitalized as the infection became very serious. And he's been here 20 years, and we're trying to help him get status. And frankly, I've done work, years ago I did some work with health advocates in Hounslow, and they found a minority, it's true, but they found receptionists who had frankly racist and xenophobic attitudes towards migrants. And actually, I think because of the rules about charging in hospitals, which are 120 pages long, not the rules, but the guidance about how to implement the rules. Actually, most NHS workers don't actually know who's entitled, who's not entitled, what they're entitled to, what they're not entitled to. And the easiest way of dealing with confusion about entitlement is to say, no, you're not allowed. And in fact, I used to have discussions and actually wrote articles with a GP who worked for the organization Freedom from Torture as well. And I told him that undocumented migrants were entitled to GP care. And he said, no, that's impossible. They would never allow us. Now, this was somebody who liked migrants, who was very sympathetic to refugees, and simply didn't, and was an experienced NHS worker, and simply didn't believe that undocumented migrants were entitled to. And equally, and in a different way, obviously, migrants are ignorant of how the NHS works. So those are the barriers. I want to make a few points about how migrants themselves experience services, which become further barriers. There is a reluctance in GP practices to use language services, translation services, and I don't know whether I don't know the reason, because I don't know whether the practices have to pay the language services or whether the CCG does, but undoubtedly it takes longer and is more complicated to use an interpreter. And people frequently complain that they can't get their point across. And similarly, the traumatized asylum seeker who I spoke to the other day, who went to the GP because he couldn't sleep and was having nightmares, said all he was given was sleeping tablets. And he felt that through the shorter part, his language was actually very good. He could speak English. But he felt that there was a lack of in-depth investigation and an inability for him to be able to explain the problems that he faced. And on another score, a lot of our visitors say, that they feel unwelcome if they complain, if they don't, they ask, can I have the result of an X-ray? And the GP says, I haven't yet got it. And they say, well, the X-ray was 2 weeks ago. And they say they can't find it in the notes. And they say, can I make another appointment? And we have somebody like that who I knew the story of. She herself had a history of trauma from domestic abuse, and she had pain in her legs and her back. And she kept being fobbed off. And she felt it was directed at her. Now, I would say that lots of us have complaints about the NHS and the short appointments and being fobbed off. But if you're vulnerable, then that experience feels as though it's directed at you and it's not just the system. And I think it's a really big, important thing for NHS workers to think about. What does it feel like if you're a migrant and you're in need and you've got no money and you're fobbed off? And it's different from if you are settled and live comfortably and feel you know the complaints procedures. And the final thing,
just a few more minutes. Okay, thank you, Ryan.
Is that the cost of people, because people don't know that they can get exemption from prescription charges regardless of their immigration status. That may well also be a reason for avoiding going to the GP, because then you'd have to confess that you never took the last lot of pills. And so, but there are many issues like that. And I think it's really important actually for GPs and primary health staff, and more than all, receptionists, to know what migrants' experience of GP services is. So I was very pleased. I'll be very quick with this slide. This is just a very, very brief summary of the Health Watch report, which I thought was really important, the things I've put in red, that the CCG should encourage, Health Watch should ask the CCG to encourage GP patients not to refuse to register patients who can't provide proof of ID or address. And that they should actually, GP practices should adopt a registration form that's sensitive to the inability of some residents to provide that proof. And as I say, above all, train reception staff to implement these rules. And I've got 3 visual slides without words, which I'll be very quick. This is actually the form with all the instructions on how to register. Do I need ID to register? How do I find a doctor? And I've put on it the link so that if anybody wants to get that form and use it themselves or pass it to other people, that's the link. There's another page, but I thought that this is the useful page. How to find a doctor, what does it cost, and the fact that it's free, and that you don't have to provide ID. And that's from NHS England. I've put this up because Doctors of the World, which is a national charity, has set up something that they call the Safe Surgeries Initiative. And that is to encourage GP surgeries to follow certain simple rules to make clear to their patients that the surgery is safe. I think, and again, I've put the link in, I think it's very important that we know, those of us who work with migrants, about this. And actually, Malcolm might have something to say later, because it's very hard to find a list of who has signed up to their initiative. And they've got a general toolkit and a toolkit for COVID. And finally, for anybody who's interested, there is a walk-in vaccination in June in Leighton. And it's important that we share these posters and leaflets with people who don't have ID and don't have NHS numbers. They can be vaccinated without a GP, though it's always preferable to have a GP. Thank you.
Thank you so much, Ray, and thank you very much, Thomas. Do we have some more questions? I've got a few questions which I'm going to read out in a while, but are there other questions?
I'll stop sharing.
Questions, please. Please. Nobody's got any questions? Surely. Okay. Just one question to you, Rhea. Apart from the sort of work we're already been doing with regard to the report that we published, I just wonder what you would suggest about other methods of trying to ensure that GP practices are following the rules more closely and being more sympathetic to people who...
I think that's a really important and difficult question. I don't know, again, Thomas will be able to enlighten us, but I think GPs do have regular meetings together in the neighborhoods. And I think it might be a good idea to ask them if you could present your report at one of those meetings. Yeah. And also hear what, I mean, I might have sounded very angry with GPs, but I understand that they face a lot. I mean, I understand that appointments are short and that it's difficult to do interpreting and all those things. But I also, because I work with migrants, I also know what it feels like to be, or I've been, you know, on the receiving end of that. And I think that actually it's like that vaccine hesitancy. If the GPs are hesitant in not asking for ID and not asking for addresses, maybe we should talk to them and find out what's the basis of their hesitancy and see if we can help them overcome it sympathetically and let them know what it feels like to meet a hostile receptionist.
Okay, that's very helpful. I think the idea of Healthwatch going to the 8 neighbourhoods and presenting to them is a very good idea. Are there other questions, please, or I'm going to read out a few? No?
There's one in the chat.
Okay.
There's not a question as such. It's more a description of a scenario.
Yeah.
So in the scenario that's been described, I'm surprised. I don't know. It's hard to answer. It's hard to. There's, like I said, like I put in the slides, there are sometimes legitimate reasons why a GP might not want to might not want to register someone outside the catchment area. I don't know the condition of this informal carer, whether they might need home visits or anything in particular.
Thomas, shall we just maybe read the scenario before we continue so everyone can...
Okay, so it says, where an informal carer wants to be registered at the same surgery as the person they care for, or the other way around, to request the person they care for also to be registered at the same surgery, e.g. the person was only one width of a road outside the catchment area, but the request was refused. So there's a couple of things here. I think I would have thought that most GPs would be receptive to that request, but then it's more difficult if the carer is registered somewhere and then the person they informally care for, depending on where they live, then wants to register for the same GP, because it suggests to me that someone that's in need of informal care may need home visits or more intensive care from their GP practice, and I wouldn't recommend for someone that has those needs not to be registered, live within the catchment area of their GP. But in terms of like a common sense request for a carer that is mobile and doesn't have like complex health needs, it seems to me that most practices would be receptive to that request. But again, you'd have to approach them, and it would be taken on a case by case basis in that scenario.
Okay, thank you very much for that. Just we've got a sort of few interesting questions, maybe just about perhaps practice. So, can you confirm that all GPs have a catchment area, and that catchment area is the boundary within which they expect to register?
Yeah, so all GPs in their contract will have a specified inner and outer catchment area.
Yeah.
They will take
inner and outer.
Yeah, so they'll take new registrations from anyone that lives within the inner catchment area, and then the outer catchment area is kind of becoming a bit antiquated, but it's basically around patients that were registered at the GP that might move outside of the inner catchment area but are still within that catchment area can stay with the GP. Technically, if you move further afield outside of the catchment area, if you move after registering with GP, the GP has a legitimate grounds to sort of deduct you and ask you to register elsewhere. But normally this doesn't happen unless it comes to a head where it's clear that you have care needs that are more specific to your location.
I mean, at one time it was quite common for GPs to visit people at home, and that's actually pretty rare nowadays, isn't it?
I
At
think
one time it was considered standard practice.
It still happens. It does still happen, but it happened because of the modern health service and the pressure on it. It happens in relation to specifically pre-identified and risk stratified frail patients, and so we have a local enhanced service in City and Hackney, which is around proactive home visiting of very frail patients to avoid hospital admission.
It'd be nice to get a copy of that information, actually. Got another question here. It says, where the catchment area is rigidly enforced, there needs to be some flexibility. Two scenarios come to mind. Sorry,
no, go, please finish.
Okay, two scenarios come to mind. One is where an informal carer, actually this is...
Yeah, that's the one I put in the chat.
I apologize, it's the same one. The other question was, in a real life situation, for example, the person, I think that's the same one as well, it's about the catchment area. Yeah, there's one here about the scenario where the surgery is inaccessible to wheelchairs, but the nearest accessible surgery enforces a rigid catchment area. So what kind of flexibility might there be for somebody with a disability who get to the nearest practice because they don't have disability?
So I just want to check I understand that fully. So that's basically, so they're all of the practices that they live within the catchment area of do not have adequate wheelchair access.
Yes.
Okay, that is a very specific scenario. Because that will very much depend. I mean, you could, obviously that person could make the argument to the next most local practice that does have wheelchair access. But some practices are in a bit of a difficult position in relation to that, because as you know, Malcolm, from your time on the Primary Care Commissioning Committee, they don't always have direct control over the suitability of their premises. Yeah. But I'd be interested to know. I mean, if that person wanted to approach me directly,
okay, we can arrange that.
Yeah.
I mean, I think the question here is whether the Equality Act is relevant in terms of requiring a practice to show some flexibility if access wasn't available nearer to where the person lives.
I don't know the answer to that in terms of legislative requirement on a practice, I'm afraid, but I can go away and try and find out for you.
Yeah, thank you. I think it's something that's worth investigating, really. Another scenario, another question we have here is it says some surgeries in Hackney offer translation services or culturally appropriate services. A patient who only speaks a community language or needs sensitive handling would naturally request to go to a surgery which could most appropriately meet their needs. Is there any flexibility around language or culture, for example?
Well, it tends to be, I mean, it tends, well, I suppose there's a couple of points that need to be made here. I mean, generally the GP registration will operate on catchment area. So if I don't think the question is whether there should be flexibility on whether a GP that has a perhaps Derman or a certain interpreter charity in like attending certain sessions at their GP, whether they should be under pressure to take people from outside their catchment area who might need those interpreted services. It's more about practices for whom that patient lives within a catchment area offering those services. I think is probably the more effective way of dealing with that. Now, there are practices that are identified as having kind of quite large populations of people who speak certain languages as a first language. So for example, Lower Clapton has quite a substantial Turkish population, and I believe Durham do some sessions, or at least did pre-pandemic, where they would be on site, a couple of their interpreters for like a certain session per week. Now, but the thing I would add there is that all practices, and this kind of goes back to a point that Rhea made, but basically, I mean, all practices in City and Hackney have access to like bilingual advocacy service that's commissioned via the Homerton. There are obviously limits to capacity at that service, as with any other NHS service, but they should be able to access face-to-face interpretation, and they all have access to over-the-phone interpretation. I suppose sometimes how the practice organise those things can vary, because the facts of the matter are that a telephone interpreted consultation is going to take longer than the 10-minute slots that are sometimes available. So some practices are very proactive in how they organise those sessions. If they know that they have someone in that's going to need that kind of level of interpretation, then they will book a double slot out. So operationally practices need to give thought to how that works, and I think certainly the CCG has a good track record of making sure that practices do not suffer financially from trying to offer an enhanced service in that sense. We've commissioned certain things under our CCE contract with practices to try and ensure that they do give enough time to making sure that people who do not speak English as their first language needs are met. But those, I think the route there is not whether the flexibility should be over catchment area. It's more about making sure that practices with the options of practices to that patient wherever they live have adequate interpretation services and to allow them to access those services.
Okay, very interesting. Thank you very much. The further questions, Rhea, did you have anything further?
I'm interested in that, because I think that's helpful. But actually, the financial if everybody has access, if all practices have access to the bilingual advocacy service and to telephone interpreters, who actually bears the cost of the interpreting? Separate from the double appointments? Is it the practice or is it the CCG?
The CCG commissions that service. It's available free to practices. Yeah.
So the practice doesn't bear any financial penalty for using an interpreter, but certainly the appointment takes longer. It seems to me that we also have in Hackney, I think an awful lot of languages spoken by GPs, and that there is I just wonder whether if you like, a degree of rigidity about catchment areas could be at least reconsidered, because there is a sense in which if you're a Turkish speaker or a Lithuanian speaker and you know a practice not very far away that has a doctor who speaks that language, that would obviate the need for using the interpreting service, and you wouldn't need longer appointments, and the patients might be happier, which is, and in some way, I mean, it's always better not to have to use an interpreter in the sense of the quality of communication isn't mediated by an interpreter. So I just wonder whether, I mean, I think it would be so great if we could somehow apply some imagination to opening up some of these issues. And I think this sort of conversation is just a very useful starting point.
Yeah, it is. Do you want to respond to that, Thomas?
Yeah, I think there's a couple of things worth saying. I mean, so the catchment areas and the basis on which GP registrations work is a national contract, and the sort of guidance manuals and the contracting is not something that we can necessarily influence wholesale at this from a City and Hackney perspective. We can't deviate from the national contract. But the other thing I'd add to that is that if you look at mapping data around the kind of the which basically will map the registrations of a particular GP practice over a map compared to their location and their catchment area that we have access to. Almost every single practice in City and Hackney has got patients registered all over the borough. In many cases, practices do not rigidly apply the catchment area scenario. They do. I know of several that are happy to take registrations from outside the catchment area, but I suppose it just does need to come with the caveat that there are circumstances where living outside the catchment area of your GP practice could potentially be detrimental to care, and then really it's the GP who holds the risk for the care of their patients. Really has to be at their discretion over whether they take that registration on. So there's a bit of a balance to be struck, I think.
Yeah. I mean, as I understand it, the regulations make it possible for GP to register patients anywhere they wish to.
They do, yes. So
yes.
There are provision within. So nationally, NHS England added something called an out of area registrations enhanced service to the GP contract.
Yeah.
So if, for example, if there were specific reasons why for a patient, for example, I don't know, if you were moving to another part of London and you wanted to stay with the GP that you've been with for many years, you could ask that GP to deduct you and re-add you under the out of hours registration scheme, out of area registration scheme even, and then that would mean that a commissioned GP from closer to where you live would be where they'd signed up for this enhanced contract would be asked to make a home visit in the event that you needed one. So there are options to you if you really are, if a patient is really intent on being registered to continue to be registered with a certain GP and has good reasons, or if you want to exercise choice, even if you hear that one GP is particularly good or a practice is particularly good. But so these I've linked some stuff in the slides that hopefully will be circulated, which have a bit more information on that.
Good. We've just got time for one or two final questions. Go on. Somebody must have a really interesting question they want to put.
Well, if no other questions are coming, I would like to ask one.
Oh, go on, Canary, you're very welcome.
Thank you, Malcolm. Well, my question is for Thomas. Thomas, I'm surprised to hear that the full cost of telephone interpreting is covered by the CCG, because the feedback we received from, sorry, was that not right?
We commission a telephone interpreting service, a full service under the bilingual advocacy service that we commission as part of our contract with Homerton. And they subcontract to lots of interpretation charities that do the sessions at practices for did face-to-face before the pandemic. All practices, telephone interpretation is definitely centrally funded, commissioned by the CCG. In some cases, practices opt to pay charities to come in and do additional face-to-face interpretation sessions at their practice above and beyond the standard offer under the bilingual advocacy service. It's not so much that I was going to refute what you were saying, it's just a qualification that we pay for the vast bulk of it, but some practices choose to pay for more because they see the need, which is, I suppose,
which is great.
A point worth mentioning as well, yeah.
Yes, thank you. But my question was really about telephone interpreting specifically, because we know that the number of face-to-face interpreters is quite limited, especially now during the pandemic. But the feedback I personally heard from several Turkish speakers, specifically members of the community, they were saying that pre-pandemic and during the pandemic, their GPs are actually, they are reluctant to use the telephone interpreting services, and patients were told this cost us money.
Yeah, that's not right. I don't know if it's hard to say really. If the individual members of staff is maybe got the wrong end of the stick, or they're not quite as informed about where this service is commissioned and how it's paid for, there might be an issue there. But yeah, I'm not entirely sure why they would be told that. So
would you then confirm that patients can actually request on having a telephone interpreters during sessions, or if the face-to-face interpreter is not available?
Absolutely. What I would recommend is that anyone that feels they need interpretation is that they advise their GP as they make the appointment. So tell them in advance so they can queue up that interpretation, because when you're using telephone interpretation, you do have to contact them, and then you ask for the interpreter you need, and then you wait to get put through, and you can't queue them up one by one because so I think it's the best thing that a patient can do is inform the GP of their need for interpretation, and then obviously and then when they make an appointment, it's like practices should have alerts within their clinical system which tell them that the patient needs interpretation, but it's worth the patient saying it as well, to say please book an interpreter for that session.
Yes, and I think it will be really useful if this service, the availability of this service, is widely promoted within the practice as well, because some people don't even know that this exists and they can use it. And we all know what a wrong interpretation or no interpreters can cause in terms of diagnosis and treatment. Yeah. So that's quite important to be known by people who actually need them.
We need to wind up now, but do Thomas or Ray like to make any final comments? Final comments.
Thank you. Yeah, I'd just like to say briefly, I mean, I think it would be great to be able to meet with groups of GPs if they meet, but I also think, I don't know to what extent there's a need whereby a practice could become not exclusively at all, but in some sense a practice that specializes in meeting maybe particularly undocumented migrants or people who are asylum seekers, so that there's a kind of ethos in the practice that they recognize those needs. That, I mean, it is difficult for all, practices are all over the place and they're small. And I recognize that not everybody may be interested in this issue, but I think it is something where the knowledge of receptionists and the clinical staff actually makes a difference in the interaction between the patients and the practice, and would facilitate registration.
Okay. Thank you so much for that, Raya. And Thomas, any final comments, please?
No, I suppose to say, I mean, in terms of kind of practices understanding kind of migrant health needs, and we do encourage them to sign up to the Safe Surgeries program and engage with the toolkit. We've written to all practices in the past on a couple of occasions to encourage them to do this, and it is something our clinical lead has recently been exchanging emails with the Doctors of the World lead of the program. So it is something that we are constantly trying to do it. In the past, the CCG has had grant schemes with local voluntary sector organisations around signposting for migrant health and helping them register with practices, and it's something that we've kind of done over in recent years. Generally, is trying to kind of like break down those barriers and try and understand the migrant needs health assessment as well. So it is something that is in our minds, and we sort of welcome this kind of engagement.
Thank you so much.
Could I just ask, do you have a list of the practices that have signed up to the Safe Surgeries initiative?
I don't have an up-to-date one, but I can see if I can get one.
I mean, if you could send that to Malcolm, that would be brilliant.
Yeah, That'll be fine. Good, thank you. And
Thank you.
what we will do is we'll produce a short report on the session and the questions and answers, which we'll share with you. Thank you, speakers, and thank you everybody for coming to the meeting. We're very pleased to see you all. And what's the next meeting about Canaria?
The next meeting will be at the end of June, and it's planned to be on food health. Quite important topic as well. Yes,
right.
But more details
Okay.
will follow. Thank you.
Okay.
Thank you for joining.
Okay, great. Thank you very much, everybody.
What
Very grateful.
Thanks.